Hi guys, my name is Marcella. I did my presentation on osteogenesis imperfecta. This is also known as brittle bone disease. There are a few ways to inherit this particular disease. Most commonly, it is autosomal dominant, where you have an affected parent and an unaffected parent with the likelihood of 50% of receiving this. In rarer, more severe cases, it is inherited autosomal recessive, where you have both parents as carriers. 25% will inherit this disease, 50% will be carriers, and 25 will be completely unaffected. In an even rarer case, there is a sex-linked, X-linked recessive, where 50% of the males will be likely to inherit this, and 50% of females will be carriers. And then there is something completely unrelated, known as de novo, and this is where there's absolutely no familial, from no familiar inheritance from it. You just kind of just develop it within the womb. This is likely seen in type 2 and is fatal for infants. It is caused by a mutation in COL1A1 and COL1A2, also known as chromosome 17 and chromosome 7. This is type 1 collagen. It's a structural protein, specifically affects bone structure. In the lesser types, you'll see just a reduced quantity of this particular structural protein. In the more severe cases, you'll see more of like abnormal bone structure. Like this photo here, you can see that one of the bones are completely bowed out. And you'll notice that in a lot of the photos that I chose to put in my presentation. The symptoms, again, do vary based on the type and the severity of this particular disease. OI has about 8 different types. However, mostly all will exhibit fragile bones. They'll typically have a shorter stature, have some sort of bone deformity. You'll notice blue sclera, which is a blue tint to the whites of your eyes, loose joints, hypermobility. They do experience some sort of hearing loss due to the frailness of the bones in the ear. Brittle teeth, and all of this is caused by that collagen defectiveness or an insufficient amount of that particular structural protein. To diagnose this is diagnosed at a young age. First and foremost, they'll just kind of look at you and see if you are exhibiting any of those previous symptoms mentioned. After doing that physical exam, they will kind of do a genetic test to kind of see if chromosome 17 and chromosome 7 do have any sort of abnormalities to them. In genetic testing, they can also determine which type of OI you have. Like I said, there are 8. After that, they will do some sort of imaging testing. X-rays can show deformities in the bones. They'll also show breaks or fractures within the bones. So that is kind of how they will diagnose this. Brittle bone disease is known as a rare disease. Only one in every 15,000 to 20,000 births have this. It does occur in all ethnic groups. There is no specific or specialized group that this favors, with the exception of type 7. This can be specifically found in First Nation communities, specifically in Canada. Both males and females are equally affected because this is not specifically a sex-linked inherent. However, with the exception of that one very rare type. There is currently no cure for this. However, there is symptom management, specifically, and excuse my pronunciation, bisphosphonates. This is a medication that does increase bone mineral density. It does reduce fracture incidence, and it can improve mobility and specifically help with pain. So this is the #1 treatment for OI. In addition, you can have surgery where they'll implant metal rods to kind of help with the structure of the bones. And then again, there is physical therapy to kind of help maintain movement within the body and help with pain. Prognosis does again vary based on the type. This does require lifelong management, so you'll be dealing with this for your life, and you'll be on medication and doing physical therapy. They do limit physical activity, specifically with those with a higher brittleness of the bone. Any sort of small activity can cause fractures or breaks in their bones, so they limit physical activity. A lot of times they'll have mobility aids such as wheelchairs or crutches to assist them. They do experience chronic discomfort. However, generally they do have a good quality of life. These are my citations. Aside from that, thank you so much. Have a great night.